Cures for Acute Illnesses as Outlined by Hippocrates, a presentation by Braden Mills. Hippocrates is an incredibly famous Greek physician from the classical period. He lived from between 460 and 350 BC and was born on the island of Kos. He, and likely his students, wrote an enormous body of writing on diseases, how to diagnose ailments, and treatments in general. This presentation in particular intends to focus on acute diseases and its symptoms and pharmaceutical treatments. An acute illness is an ailment that seizes someone quickly and can be incredibly strong, but usually passes within 7 days. Hippocrates believes that if it persists past 7 days, the illness reaches a point of crisis, though this point can arise earlier in patients. A chronic illness is a disease that persists for longer than 3 months and doesn't go away or may be incurable. Before discussing treatments for patients, we must first examine common herbal remedies recommended in the text. Though these are considered remedies, they can have both negative and a wide array of positive effects, depending on the ailments, some of which we will examine later. The first is called hydromel. It's a dry version of mead with a weaker honey flavor. He states that many acute illnesses can be treated with this, though most of the time it should be mixed with water first. Avoid giving it to patients who are full of bile or have inflamed internal organs. It's a diuretic and helps people urinate, discharge mucus, softens and soothes the lungs also when diluted with water. Without diluting it, it can cause diarrhea and jactitation, which is the thrashing of one's limbs due to medical illness. Tisane is a drink made from boiled barley that would then have their skins peeled off. Galen suggests pounding the barley in a mortarium first before boiling to remove the skins. Hippocrates states that only the highest quality barley should be used. The drink was sometimes strained, sometimes given with barley inside, but it was a very common remedy for things like fevers. Another common remedy is oxymel. Combine equal parts honey and vinegar, a sweet and sour concoction. It should be consumed warm in the winter and cold in the summer. It's said to allow patients to breathe with ease and should be administered when someone is full of mucus and that needs to be expelled. Another very common concoction is watered down wine and honey. This was said to increase a patient's strength, especially when consumed by the youth. Hippocrates strongly urges against popular treatments at this time as well. One, for example, is avoiding fasting and starving patients, especially for 2 to 3 days. Physicians at this time believed they needed to introduce a great change to counteract the illness, which they considered a great change within the body. Hippocrates strongly advises against trying to induce such a great change, and that change must be made with caution and gradually. For example, even a poor diet well maintained is more beneficial than a diet rapidly changed. The rapid change can cause great harm or even death to an already weak patient. Their body is accustomed to their diet of even potentially poor foods. Poor foods he specifically mentions being meat and garlic. Hippocrates attributes the distrust of hydromel, for example, to physicians recommending fasting or starvation to their patients, weakening them, then giving them hydromel, especially undiluted with water, which could result in their death. Outside of these instances of starvation, Hippocrates believed that hydromel was an extremely useful remedy, especially in treating acute illnesses. The most relevant symptoms of acute illness are as follows: dry and rough tongue or a sour taste in the mouth, fever, aching bones and joints, insomnolence, extreme thirst, pain in the lungs, a loose belly, nosebleeds, diarrhea, vomiting, pustule growths oozing black, green, or white liquids, and constipation. In his work on regimen in acute diseases, he outlines both the causes and remedies of these symptoms. Now, we will be covering specific symptoms and recommended treatments. These treatments can be a mix of dietary changes, herbal concoctions, or even simple pain relief techniques, such as a hot compress. First, we will be covering aching bones and joints. To begin, apply a hot compress on the afflicted area and cover the area with something to trap the heat on the body. Common applicators of heat are metal containers, earthen pottery, or bladders filled with hot water. If the pain continues, you should fill a bladder with barley and vinegar stronger than one could drink. Once this is done, stitch the bladder up and boil it. After boiling it, take it out and apply it to the side of the patient or the area where they're experiencing pain. Millet or bran can also be used as a drier application of heat and as an insulator. Essentially, put the fine material you choose to use in woolen bags and then apply it to the area where the joint or bone hurts. If the pain continues, there is an herbal remedy consisting of black hellebore, cumin, carrots, and other fragrant herbs that can act both as a laxative and a pain reliever. Another well-documented symptom to be treated is fevers. Though fevers are usually accompanied by a plethora of other symptoms, Hippocrates wrote down how to deal with a fever specifically. If a fever starts shortly after eating and before someone has defecated, the doctor should wait before giving them a tisane until they've digested their food. If they experience pain, they should first be given an oxymel to alleviate the pain, and then follow up with the tisane. If they experience a great thirst and no pain, they should administer a hydromel mixed with water and then the tisane. But never do the tisane first, as it can result in diarrhea, expelling important humors, weakness, and even death. Another thing to note is if a patient's feet are cold, you must wait before administering any liquids, and you should administer water with caution. But if their feet are warm, then administer any liquids you see necessary. Finally, our last example, we will look at the remedy for severe pneumonia. There are several remedies, but from my research, the one most practically applicable would be a mixture of galbanum, a resin with antibacterial and anti-inflammatory uses, with pine fruit and honey. The honey and galbanum both act as antiseptics and anti-inflammatory medicines, which are extremely helpful in the case of pneumonia, which is an inflammation and infection of the lungs. This is one of the best applications of medicine in this portion of Hippocrates' writing. Overall, much of his work feels very arbitrary, and he fails to expand on the benefits of many of his treatments. Reading through his writing can come off as very confusing and discombobulated at times. Galen comments as much on part 13 of this work in particular, where he states that it seems unfinished and unedited, almost as if it was published after the death of Hippocrates, before he could really finish it. Many of his treatments outright discourage beneficial things like drinking liquids or water or eating, or recommend arbitrary solutions. During his passage on insomnolency, he writes that someone should take long walks in the evening and refrain from drinking water and eating dinner to sleep less. It was particularly hard to find the reason as to why things like tisane was said to be so effective outside of its lubricating and hydrating properties. Despite this, though, Hippocrates still has good advice to give to future doctors in regards to the importance of diagnoses and some of his herbal remedies, such as the one mentioned for pneumonia previously.